It's a Northwest lifestyle weekend on Como News. IRG's Health Talk continues.
Okay, we're back with our first guest, Dr. Heather Galgon, a physical medicine and rehab specialist at Sweetish Medical Group in Issaquah and Renton. Thoracic Outlet Syndrome, in a nutshell. What is this? Sounds kind of nasty.
It is. It can be a very difficult diagnosis with some frustration for both provider and patient. But Dr. Galgon, that's what she does, and she's this detective that's going to look at it. It's an impingement or compression of the nerve bundle or the vascular bundle as it exits through your arm into your upper extremity, right?
Ooh,
so
okay.
Through your kind of the armpit area for better terms.
All right, let's hear from Dr. Galgon and Shannon O'Kelly.
Dr. Galgon, welcome. How are you?
I'm doing well. Thank you very much.
Like Tom said, you're a physiatrist. You work over at Sweetish, Issaquah. Your specialty is physical medicine. Tell our listeners about your practice.
So my practice is best described as non-operative sports medicine. So I look at the musculoskeletal system, which is a combination of muscles, bones, joints, tendons, ligaments, and nerves. My goal is to get the patient back to their full function and doing everything that they want to be doing.
Is there a specialty area of interest in your practice?
Not really. I do soup to nuts. I do a little bit of sports medicine, a little bit of weekend warrior. I do a lot of spine, so neck pain, back pain, some headaches. A little bit of everything.
A little bit of everything. Let's talk about what our topic today is Thoracic Outlet Syndrome, or TOS. Tell us what TOS or Thoracic Outlet Syndrome is.
So thoracic outlet syndrome most commonly is when you have the brachial plexus, which is a combination of nerves that leaves the neck or the cervical spine en route to the arm or the upper extremity. That bundle of nerves is getting compressed. Typically, it's getting compressed by another structure in that area. Where it gets compressed is most commonly behind the clavicle or the collarbone.
So, in summary, if we think about our nerve system and the nerves that are leaving the spine, it's like a freeway system. And there's a bunch of nerves that are leaving the neck area that go through your anterior neck, down into your arm, and give sensation, motor to your upper extremities. And when these become compressed for various reasons, as you described, that's thoracic outlet syndrome.
Correct.
And what are the symptoms?
So the symptoms can look a couple different ways. Most commonly, it can be painful. You can have numbness, sometimes tingling. You can have weakness in that upper arm, the whole arm, into the hand, into the shoulder. And rarely, but sometimes you can have swelling. It can be pale, it can be cold.
Is there a period of time during the day where symptoms maybe are pronounced, or activities that increase these symptoms, or functional movements?
So during the day, less likely. We see that a lot of times with overhead activity, symptoms really start to flare. So say someone has a job where they're stacking boxes or pallets up overhead. If you have an athlete that's an overhead athlete, so pitching, swimming, sometimes they are more predisposed to getting it.
And from a body mechanics standpoint, positioning, I would imagine, sitting long periods of time, or even maybe sleeping, sometimes will increase these symptoms.
So posture plays a huge role. So a lot of times when we sit, we don't have good posture. We see our shoulders roll forward. We see our neck come forward, our head come forward. And so that can certainly compress and make things a bit tighter, absolutely leading to an increase in symptoms.
And you talked about right behind the clavicle. From an anatomical standpoint, if we can describe it to our listeners, these nerves are kind of progressing or transversing through this tissue, and that tissue becomes tight and compresses that nerve, and that results in symptoms in the upper extremity.
Yeah, that's a great question, and that's certainly one option. So these tissues they're like a highway, but they're like a very complicated inner working play. And so they go through several different areas in between two muscles. They go around a bone, underneath the bone, and there's several different areas where it can be entrapped, including muscles in the area. Sometimes there's an extra rib that we may have, maybe an extra muscle, and then sometimes just general inflammation in that area can actually compress it as well.
Do you often see this on both sides, what we call bilateral, or is it usually on one side versus both sides?
In my practice, it's typically been one side, but it certainly can happen to both.
How do you diagnose it?
Diagnosing is tricky. It's
Yes,
definitely
it is.
tricky. So with any diagnosis, you want first a history and physical exam. That's probably the most important part. Sometimes we also use imaging for this. So imaging can be X-ray, can be MRI, can be CAT scan. At that point, if we don't have a diagnosis yet, then we go to further tests. Some of the further tests can include an EMG, or nerve conduction study. sometimes an ultrasound of this area. The ultrasound is looking at the vasculature, seeing if the blood flow is normal. And then sometimes we actually have to go to a diagnostic injection where we're actually injecting the muscles to see if it's providing relief.
We continue with Dr. Heather Galgon and Shannon O'Kelly right after this timeout on Como.
It's a Northwest Lifestyle Weekend on Como News. Now back to IRG's Health Talk.
We continue our conversation with Dr. Heather Galgon, physical medicine and rehab specialist at Sweetish Medical Group in Issaquah and Renton. Here's the conversation about Thoracic Outlet Syndrome with Shannon O'Kelly.
Thank you for coming down, and thank you for sharing your expertise in the area of Thoracic Outlet Syndrome. You and I both agree it's a very complex diagnosis, and the diagnosis can sometimes be difficult. But you mentioned various ways that you can understand this. Ultrasound, you talked about imaging, you talked about EMGs. Maybe tell us about what you're looking for in each of those diagnoses when you order that test, I should say.
Sure, absolutely. So primarily what I'm looking for is that one of these tests are going to give me that confirmation, that evidence that says, absolutely, yes, this is the problem that's going on. So most commonly with a thoracic outlet syndrome, it's a compression of the nerves. That is very hard to capture on a test. So very rarely is there an imaging test that will show that. Occasionally, we will see it in a functional test called an EMG or a nerve conduction study. This is a test where we're actually looking at the function of the nerves. It's basically looking to see if the nerve has damage to it. It will not tell us if the nerve is irritated, if it's providing unusual behaviors such as numbness or tingling. It will only show me if there's damage to the nerve. So that's an EMG. Sometimes we also use an ultrasound. An ultrasound is looking up in this region. Typically, the ultrasound looks at the vasculature. So it's looking at the artery. It's looking at the vein. It's looking to see if the blood flow is normal in this area, if there's a clot. Sometimes these scenarios can lead to the predisposition of these symptoms. And then lastly, we can also do a diagnostic injection. This is actually putting a numbing medicine into the muscles that surround this brachial plexus or the combination of nerves. By putting a numbing medicine into these muscles, sometimes that offers some relief, some decrease in pressure around the nerves, and thereby a decrease in symptoms. This is one of the best ways that we have to prove that, yes, in fact, it is a compression of these nerves at this location that's causing the pain, numbness, weakness. And it's also a nice indication that should this lead to a more aggressive treatment such as surgery, that we'd have a pretty good outcome.
Well, let's talk about treatment. I mean, great job setting up the diagnoses and the tests that you order, but what about treatment?
So treatment, to be honest, treatment is difficult. So the absolute first form of treatment is physical therapy. In order to have appropriate physical therapy, you really need someone who's done this before. You really need someone who knows what they're doing in terms of thoracic outlet syndrome. What they look at posture. They look at how you're sitting, how you're standing. It's really important that the patient is educated on why posture matters and why poor posture can be exacerbating some of these symptoms. So once the patient is taught the correct positioning, then you have to work on strengthening. If you don't have the appropriate strength or the appropriate endurance to sustain good posture, then it's almost all for naught. You have to continuously work at it. The thought being, with good posture, this can lessen the pressure on this neurovascular structure.
There you go. Everything you need to know about thoracic outlet syndrome. Dr. Galgon, thank you so much for your time.
Absolutely. My pleasure.
You've been listening to Dr. Heather Galgon, Swedish.org, if you'd like to get more information on what she talked about, thoracic outlet syndrome. There's another situation I've heard of before, about a compression syndrome of some sort that was going to be.
Oh yeah, you're right. That's an ischemic or contracture. And a lot of times, you see that in compression. We talked about this in the past, where there's a football player, right?
Yeah.
And got hit and got some swelling. So compression of the nerve, vascular bundle, similar situations.
Scary stuff. We're back with more after this on Como.